Hello, my name is Joanne Bendel, and I am the manager for the Healthcare Associated Infection Program at the Clinical Excellence Commission. I am also a nurse. World Hand Hygiene Day on the 5th of May each year is a reminder of how important this simple practice contributes to safer patient care by reducing the risks of infection. Each year, the World Health Organization leads all countries to participate in the campaign to improve hand hygiene and prevent healthcare-associated infections. This year, the call to action is clean your hands to prevent sepsis. You will hear a number of presenters today from the Clinical Excellence Commission sharing their knowledge, experiences, and their messages for improving hand hygiene and preventing sepsis. We are all individual patient advocates, and we must help each other to improve our hand hygiene and prevent healthcare-associated infections and also sepsis. I lost my 69-year-old father to a healthcare-associated infection, and I know the extreme grief of watching this very loved man die and the impact it had on my family. I urge you to think every day, do I always do hand hygiene to protect my patients?
Hello, my name's Lisa Coombs. I'm a Project Officer for the Clinical Excellence Commission's Adult Patient Safety Programme. Today I would like to talk to you about sepsis, but firstly wanted to share this video with you that contains some valuable information.
Every 3 to 4 seconds, somebody dies of sepsis. Sepsis is an emergency. Sepsis is the final common pathway to death from the vast majority of infectious diseases worldwide. It arises when, in combating the infection, the immune system damages a person's own tissues and organs. This can lead to organ failure and ultimately death. Most infections can lead to sepsis. Among them are common infections such as pneumonia, urinary infections, infections in the abdomen, skin or wound infections, or meningitis. Seasonal flu, malaria, dengue and yellow fever, and Ebola may all result in sepsis. More than 80% of infections leading to sepsis are contracted outside of a hospital. Anyone can get sepsis. People with a weakened immune system are especially at risk. This includes adults over 60, young children under 1, people with chronic disease of the lung, liver, or heart, people with diabetes or AIDS, and people without a spleen. But sepsis can be prevented. The easiest way to prevent sepsis is preventing infection in the first place, which can be done through vaccination and basic hygiene. If an infection has led to sepsis, it must be recognized quickly, and the source of the infection treated with antibiotics. Early treatment of infections and early recognition of sepsis saves lives. Sepsis can be detected by symptoms like slurred speech or confusion, extreme shivering, muscle pain, fever, passing no urine all day, severe breathlessness, feeling like you're going to die, skin mottled or discolored. Sepsis is the most preventable cause of death worldwide. It affects 27 to 30 million people a year. 6 to 9 million die. Many survivors face long-term consequences, such as loss of digits or limbs, poor memory and concentration, or post-traumatic stress disorder. It can be prevented by vaccination, sanitation measures, such as access to clean healthcare facilities, and clean water, clean delivery, and, above all, awareness. You can help end the sepsis crisis. Tell your loved ones. Participate in World Sepsis Day on September 13th every year. Donate to support us in raising awareness, prevention, and research. While you were watching this video, 55 people died of sepsis. Sepsis is an emergency. The more people know about sepsis, the safer everyone is. Stop sepsis. Save lives.
The Sepsis Kills program supports clinical staff to recognise and manage sepsis as a medical emergency. It encourages staff to recognise the risk factors, signs and symptoms of sepsis, resuscitate with rapid administration of intravenous antibiotics and fluids, and refer to appropriate senior clinicians and teams with a retrieval if appropriate. Sepsis pathways have been developed for adult, newborn, maternal and pediatric patients, and they assist clinicians to recognise, resuscitate and refer. Hand washing can protect your patients from developing an infection and potentially life-threatening condition, which is sepsis. Sepsis kills. It's in your hands.
Hello, my name is Ian Crawford and I'm a Project Officer for the Healthcare Associated Infections Program at the CEC, but I'm also a registered nurse with nearly 20 years experience in intensive care nursing. I'd like to share some observations that may be helpful for you to provide safer care to your patients through better hand hygiene. There are many strategies to prevent infection. However, hand hygiene is the one element that underpins them all. And yet hand hygiene compliance data shows us that there are obvious areas for improvement. This is a breakdown of the 5 moments for hand hygiene. What we can see is a pattern that is mirrored in many facilities, jurisdictions across Australia and even internationally. Health workers are better at cleaning their hands after touching a patient than before. So what does this mean for the patient? It means that there is a risk that different organisms can be introduced to the patient by the hands of health workers. This introduction could lead to colonisation or infection that may result in sepsis. Only by cleaning our hands before we touch our patients can we prevent transmission of harmful organisms and protect our patients. We must be mindful of this simple but important skill. Mindfulness is about cultivating awareness of the present moment and with acceptance rather than judgment. We know hand hygiene performance in hospitals has greatly improved over the last 10 years, but we can still do better if we are mindful of why we do it. We must also be mindful of barriers to better hand hygiene, such as inappropriate glove use and touching curtains. Gloves usually prevent hand hygiene from being done at appropriate times, are often overused, and can lead to hospital environment contamination, such as curtains. It is easy to imagine the next health worker to come along, touches the curtain, contaminates their hands with fresh foreign organisms, and then moves on to the next patient. So let's be mindful when it comes to hand hygiene and protect our patients by cleaning our hands before we touch them or do procedures. Every patient, every time.
Hi, my name is Mayra and I am the Improvement Lead for the Pediatric Patient Safety Program at the Clinical Excellence Commission. I'm a registered nurse by background with experience in the paediatric critical care environment. Pediatrics are a vulnerable population as their immune system is immature, particularly in patients under 1 year of age and those who are not yet fully immunised. This makes children more susceptible to infections. As paediatric nurses, the environment and the way we care for our patients is unique, and it is important that we recognise these differences and the potential risk we may pose to our patients. Carrying and cuddling children is an everyday practice in the life of a paediatric nurse. However, we need to be aware of the potential bugs that we may be exposing to our patients and ourselves. Ensure that you wear a gown when holding children and attending to their cares. Be vigilant to perform hand hygiene before and after cuddling a patient. A new gown needs to be used for every encounter when holding a child and should not be hung at the end of the bed or cot when no longer required. A new and clean gown should be used at each occasion. Toys are an essential part of a child's learning and development, and this does not stop when a child enters a hospital. All shared or communal toys should be wiped down with an appropriate antibacterial wipe regularly when used within a communal playroom. All toys used within a patient's bed space should be cleaned when no longer used. Let's work together to keep our patients free from unwanted bugs. Care for your patient as if they were your own to ensure that they are kept in safe and clean hands.
Hello, my name is Ian Richards and I'm lucky enough to be dad in this family. as well as being a physiotherapist and a senior advisor on strategic implementation at the CEC. First, I want to tell you a quick story about a small injury in our family and how rehab is a family thing, and then make a few observations about reducing infection risk in rehab while we help patients to be as active as possible in their environment. A few weeks ago, my 7-year-old, Owen, fell at soccer and broke his collarbone. A broken collarbone, particularly in a child, is a minor injury. The impact, though, is broader. After taking some advice from the clinicians, there is no one better placed to help Owen get back to his crazy best than his family. With his dominant right arm in a sling for 4 weeks, my previously fully independent 7-year-old initially needed help with his daily cleaning, toothbrushing and toileting. He has needed help to put his sling on and off and has been learning how to get dressed, eat his food and buckle himself into the car one-handed. The point is, there are more people interacting directly with Owen every single day. There are more people sharing their germs with him. The fact is, Owen is healthy, strong, with a good immune system and no open wounds. The risks for him are low. What if Owen had more risk factors? What if he had a more complicated injury, illness, or surgical procedure? Let's imagine for a second that he's older and has had a cardiac surgery, or a stroke, or a total knee replacement. It is my job as a physiotherapist to help Owen get back on his feet. It is my job to help him interact with his environment. It is my job to help him and his family be leaders in his rehab. If I'm doing my job well, the number of interactions where there is potential risk of infection will be high. Just think about it. Walking aids, getting out of bed, getting to the toilet or shower, practicing stairs, walking down the corridor, walking outdoors, practicing his exercises. The number of interactions with patients, staff, family and friends will be high. These interactions might be both direct or indirect. It might be that he's directly getting germs transferred to him, or he might be picking up germs that have been left behind on walking aids, door handles, or on rehab equipment. My top tips to help reduce risk for safe rehab are: number 1, hand hygiene for all. That means for myself, other staff, the patients and their families. This is a simple active thing that they can do to help with the rehab. Number 2, make sure that all equipment, whether it's the walking aids, exercise aids, or even rehab plinths, are consistently cleaned between patients. Number 3, educate for their self-sufficiency. The sooner the patient can safely do their exercises or mobilize or manage all of the daily functions, the sooner there will be less people that they are interacting with. Also, evidence shows that people pay outstanding attention to their own infection control. Number 4, safely home early. The sooner that my patient is ready to go home and be safe, the sooner they will be away from unnecessary interactions with other germs, patients, or clinicians.
Hi, I'm Yvette Borno and I'm the Antimicrobial Stewardship Program Leader at the CEC and I'm also a pharmacist. As you learnt earlier, sepsis treatment requires prompt, effective antibiotics. And antimicrobial resistance, which occurs when bacteria and other microbes develop defenses against antibiotics, really jeopardizes our ability to treat infections and treat sepsis. Implementing antimicrobial stewardship is one of 7 objectives in Australia's National Antimicrobial Resistance Strategy, along with improving infection prevention and control, such as good hand hygiene. In New South Wales, we know about 1/4 of antibiotics prescribed for our inpatients are inappropriate, so there is much room for improvement. This is a problem because suboptimal antibiotic therapy can increase the risk of patient harm, and this can be through the development of resistance that can then be spread to other patients, or through delayed or inadequate therapy for that patient, or it can put the patient at risk of side effects and toxicity. To improve the way we use antibiotics in New South Wales hospitals, antimicrobial stewardship programs have been developed and rolled out. These aim to improve patient outcomes, ensure cost-effective therapy, and reduce some of those adverse consequences of antimicrobial use. Please visit our website for a range of resources and tools to support antimicrobial stewardship in your hospital.
Hello, my name is Kate Cleese. I'm a clinical advisor to the Healthcare Associated Infections program here at the CEC, and I also work as an infectious diseases specialist at a large tertiary referral hospital here in Sydney. I'm going to talk about doctors and hand hygiene. And I would argue that most, if not all, medical staff can provide really good reasons if they're asked why their hands need to be cleaned before they examine a patient, access an indwelling device, remove a dressing, or inspect a wound. It is very likely that they will know this is to reduce the risk of infection in the patient and also to reduce the risk of transmission of organisms, particularly organisms that are resistant to multiple antibiotics. However, knowing this information doesn't always lead to excellent hand hygiene. Hand hygiene is a critical part of routine patient care to prevent infection, including sepsis, and understanding how we can improve this is worth many conversations. There are some important considerations in looking at behaviour change for hand hygiene, such as what is the organisational culture? If this is one of it's good enough, then this kind of mediocrity will undermine hand hygiene performance. There are also broad groups of staff who challenge behavioural change. These are described as active resistors, those who say, I've always done it this way, why should I change? And organisational constipators, and these are people who much more actively resist change. It requires consistent leadership to affect behaviour change, particularly in these groups of people. One method that's been shown to improve hand hygiene in medical staff is to show them what's been cultured from frequently touched surfaces, such as keyboards and door handles. And this improves hand hygiene behaviour, but this behaviour change is really that improves protection for the medical staff and not for the patients. Cleaning our hands effectively is more than a quick squirt of alcohol or a splash of soap and water. And we know that effective hand hygiene for patients requires its own technique. So it is our responsibility to learn how to do hand hygiene properly that protects our patients and us, and to provide leadership in consistently, openly and generously including hand hygiene for all of our patient contact.
Hello, my name is Carrie Marr and I am the Chief Executive of the Clinical Excellence Commission. The CEC is thrilled to be involved in this year's World Health Organization World Hand Hygiene Day campaign because at our core, we believe every level of the health system is committed to delivering safe, quality care to all our patients and their loved ones. I would like to thank you for listening and leave you with some discussion points to continue the conversation with your team at your local facility. Have a look at your ward or your unit's hand hygiene results. If it shows that your hand hygiene before you touch a patient or before a procedure could be improved, how do you think you, your team, and all other health workers who come into your ward or unit will improve to protect your patients? The Sepsis Kills programme is embedded into hospitals across New South Wales. Share your experience with colleagues about how you have recognised sepsis and how you've used the sepsis pathway on a patient in your ward or unit. I invite you to continue our hand hygiene conversation with your patients, their families, and your teams. Help prevent sepsis. It's in your hands.